Hey everyone, welcome. So if you work in medical coding, clinical documentation, or healthcare admin, you already know the drill. The annual ICD-10-CM updates can honestly feel like you're trying to learn a completely new language overnight. Well, today we are bringing you a comprehensive A to Z explainer of the massive 2027 ICD-10-CM Alphabetical Index Addenda. We've taken all of those dense, highly technical updates from the source files and transformed them into clear, visual slides to help you immediately update your coding workflows. We're going to walk through this alphabetically, making it incredibly easy to digest. Make sure you have your notepads ready because the level of clinical specificity required this year is pretty unprecedented. Here's our roadmap for today's explainer. We'll start with A through D for our key changes, move to E through H covering new exposures, and then dive into I through O for clinical updates. After that, we've got P through S focusing on pregnancy and syndromes. We'll wrap up the alphabet with our T through Z final updates, and then finally, join the discussion. All right, let's dive into this. Section 1, A to D, key changes. Okay, so right off the bat, we're looking at a major structural shift for 2027 when it comes to venomous bites. In the past, if a patient came in, say they got bitten by a venomous spider, snake, or maybe some sort of marine animal, you'd naturally head straight for the specific venom index, right? Well, scratch that. For 2027, this whole index has been completely overhauled. Now, literally all venomous animal and marine bites are going to direct you straight to the table of drugs and chemicals under poisoning. So whether we're talking about a centipede, a lizard, or a sea snake, the index is forcing a total shift in your lookup strategy. It absolutely standardizes the workflow, which is great. But man, it means you're really going to have to break that old muscle memory of always searching for the word venom. Now, take a look at the number 18.4. This is a highly specific, brand new threshold for adult body mass index. Over the last few years, you might remember the index kind of lazily lumped lower BMI patients into this vague 19.9 or less bucket. Well, that code is totally gone for 2027. Deleted. In its place, we've got a brand new, ultra-specific threshold of 18.4 or less that maps directly to code Z68.18, alongside a totally separate code for that 18.5 to 19.9 range. It's a real game changer. This is a perfect example of why clinical documentation improvement teams really need to make sure physicians are capturing the exact BMI value, not just scribbling underweight on the chart. And hey, quick side note, if you're finding these breakdowns helpful for your day-to-day coding, please take just a split second to hit that like button on this explainer and subscribe to the channel for our daily updates. Sweeping up the rest of these crucial A through D updates, you're going to notice a huge theme. The index is practically screaming for greater specificity across the board. Basically, we're all going to have to get a whole lot better at deciphering physician handwriting this year. For instance, take bronchitis due to chemical, gas, or fume exposure. The index now strictly points you to J68.4. We are officially moving away from those older, much less specific respiratory disease codes. Over in cardiology, cardiomyopathy has expanded beautifully. We now have specific indexing for familial genetic types at I42.01 and biventricular types at I42.81. Oh, and this is a big one. The words comfort and hospice have been explicitly added under care, so that's going to reliably direct you to Z51.5. Finally, if you're dealing with constriction or hypertrophy of the pylorus, that's been cleanly updated to point to Q40.0, specifically when it's congenital. Moving right along. Section 2, E to H, new exposures. And this brilliantly illustrates our next big theme. Modern environmental hazards, medical treatments, and military exposures are a massive focus for the 2027 updates. The tracking here has become just incredibly specific. Under contact with or exposure to, the index has added some really granular codes to better capture patient histories. For example, Agent Orange exposure now specifically maps to Z77.33. We've also got entirely new indexing for blast overpressure. This is a genuinely critical addition for military personnel and veterans, complete with unique codes that actually differentiate between high-level and low-level blasts. Burn pits in the war theater, they finally have their own dedicated home at Z77.32. And it's not just military stuff. Over in the medical realm, exposure to gadolinium, which, as you know, is a very common MRI contrast agent, has been explicitly added to Z77.013. This comes right alongside new codes for abnormal gadolinium levels in the blood. Ultimately, this all paves the way for some incredibly accurate epidemiological tracking. Also in this section, we've got a critical update to liver fibrosis staging. The old, honestly somewhat vague F1 or F2 stages, they've been entirely deleted from the index. Gone. In their place, the 2027 addenda is bringing in strict terminology. Mild liver fibrosis now routes to K7401, and moderate routes directly to K74OA. So if you work anywhere near gastroenterology coding, you absolutely have to ensure your providers are explicitly documenting the words mild or moderate in their notes, rather than just jotting down F1 or F2. All right, into the middle of the alphabet we go. Section 3, I to O, clinical updates. First up here is a brand new acronym you're definitely going to see popping up in the index, IFALD. That stands for Intestinal Failure Associated Liver Disease. It's a newly indexed condition that's now securely categorized under liver diseases, mapping over to K76.83. Having this plain language definition and a direct index entry is fantastic. It means coders will no longer have to waste time querying providers or just outright guessing which unspecified liver disease code to use when a patient presents with this very specific complication of intestinal failure. Now listen up, because this next one is easily one of the most critical behavioral health updates of the entire year. Previously, if a patient presented with opioid-induced anxiety, depressive disorders, or sexual dysfunction, but without a specified use disorder, the index just defaulted to the F11.9 series. That's unspecified use. Well, the 2027 index completely rewrites this logic. Now, these specific opioid-induced dysfunctions map directly to the F11.2 series, which designates moderate or severe dependence. What does this mean for us? It means the index inherently recognizes these severe clinical manifestations as actual indicators of dependence, rather than just shrugging it off as unspecified use. It's a massive shift in how psychiatric and substance use complications are classified. Your behavioral health documentation is definitely going to need to reflect this new nuance. Okay, let's keep this momentum going. Section 4, P to S, Pregnancy and Syndromes. Let's take a look at ectopic pregnancies. Historically, the coding here was, let's be honest, pretty broad. It often lacked the anatomical specificity that surgeons were actually documenting in the OR. Thankfully, the 2027 targeted coding solves this beautifully. The index now demands surgical-level precision. It adds precise pathways for an ectopic pregnancy located in a previous cesarean scar, which maps to 00.31, as well as interstitial pregnancies, which map to 00.12. We're also seeing similar expansions for cervical and corneal pregnancies. The huge takeaway here? OB/GYN coders finally have the exact codes they need to perfectly match the specific anatomical sites documented by the surgeon. Building on that maternal care theme, the index for encounters related to fetal chromosomal anomalies has just exploded with specificity. When a pregnancy is complicated by or requires maternal care for a fetal abnormality, we are no longer relying on a generic catch-all code. The index now spells it out. Clearly, Down syndrome routes to 035.13, Edwards syndrome to 035.12, and Patau syndrome to 035.11. Conditions like Klinefelter and trisomy X, they get their own distinct pathways now too. On top of that, vanishing twin syndrome has been officially added to the index under 031.4. This whole section is just a massive win for accurately reflecting the true real-world complexity of high-risk obstetric care. So the crucial point here is how the index is finally handling newly recognized pediatric and genetic conditions. Take PANS, for example, or Pediatric Acute Onset Neuropsychiatric Syndrome. If you're not familiar, this is a condition characterized by a really sudden, dramatic onset of obsessive-compulsive symptoms or severe eating restrictions in children, very often right following an infection. It has finally been officially indexed and categorized under D89.89, which is the umbrella for other specified disorders involving the immune mechanism. Having this direct indexing is going to save pediatric coders an absolute ton of time. And hey, PANS isn't the only one making its debut. Genetic and autoimmune syndromes are practically taking over the index this year. They're introducing highly specific, newly recognized syndromes that you're going to need to commit to memory. We've got alpha-gal syndrome, that's the tick-borne meat allergy, now indexed right at Z91.014. We have explicit new indexing for BRCA1 and BRCA2 cancer predispositions, Loeys-Dietz syndrome, Lynch syndrome, and VEXAS, which is a really severe autoinflammatory syndrome that now directly maps to M04.3. The level of genetic detail required for 2027 is honestly staggering. It means your documentation absolutely must clearly specify the exact syndrome or mutation. Relying on those generic other specified syndrome codes, that simply won't cut it anymore. All right, we are in the home stretch. Section 5, T to Z, final updates. Back over in the cardiology realm, sitting under the ventricular tachycardia umbrella, we have some brand new indexing for CPVT and FPVT. That's catecholaminergic polymorphic ventricular tachycardia and familial polymorphic ventricular tachycardia. Say that 3 times fast, right? Both of these now map precisely to I-47.22. These are severe, often genetic, heart rhythm disorders that can cause sudden fainting or even cardiac arrest. Having them explicitly listed out in the index is huge. It prevents coders from getting totally lost in the weeds trying to decipher those incredibly complex electrophysiology reports. Here's a quick but super important reminder to update your hematology cheat sheets. The old generic D69.1 code for qualitative platelet defects, it's been expanded for much better accuracy. So that old general thrombocytopenia code is officially out. The new indexing points dystrophic or granulopenic issues straight to D69.19, while Glanzmann's thrombosenia gets its own dedicated shiny new code at D69.11. It might seem like a small anatomical shift on paper, but it is an absolutely vital one for ensuring clean claims processing. Finally, to wrap up our alphabetical tour, we have a really nuanced but important adjustment for Wernicke-Korsakoff syndrome. The index has shifted exactly how it handles the alcoholic presentation of this neurological condition. It now maps generally to the F10.9- series. But, and this is the kicker, if the documentation specifically mentions dependence, the index strictly routes you over to the F10.2- series. It's a perfect capstone to our A to Z explainer, really driving home how the 2027 index is constantly, relentlessly pushing us toward capturing the absolute precise severity and dependency status of the patient. Now, what's really interesting about this next slide is where we go from here. Section 6, join the discussion. We have covered a massive amount of ground today, from venomous sea snake bites all the way to incredibly complex genetic syndromes. The crystal clear takeaway for 2027 is that generic, unspecified coding is officially a thing of the past. If it's not clinically precise, there's just no way it's going to pass an audit. So with the bar for specificity raised this incredibly high, you really have to ask yourself, is your documentation truly ready for the new year? But hey, the learning definitely doesn't stop here. Which medical coding topic should we explain next? Do you want us to do a deep dive into the new surgical guidelines, or maybe a full explainer on all the outpatient modifier changes? Drop a comment below with the exact topics you want us to tackle next. And please, if you found this clear, structured breakdown helpful, hit that like button and subscribe to the channel right now so you never miss our daily coding updates. Thank you so much for joining me to master the 2027 ICD-10-CM updates. Keep that documentation sharp, and I'll see you in the next explainer.